Hi everyone, how's everyone doing? Today I'm going to be talking a little bit about my dream to become involved in transgender care. As a doctor, I'm in my final year of medical school, and I feel like all the planets are kind of aligning, and I have this realization that, I really want to be involved in gender affirming care, and I really want to be involved in research and just generally kind of helping out in that field. So I'm kind of wanting to go back through history first a bit, understanding where we started with gender affirming care and like the doctors that came before me. I'm not a doctor yet, but I hope to be soon, and just see where they were going, what they were thinking, and yeah, let's start there. This is Harry Benjamin. He was born in 1885, and he was a prominent endocrinologist and sexologist during the 20th century. I'm reading this textbook called Transgender Health and Medicine, History, Practice, Research, and the Future by Thomas E. Bevan, PhD. So I thought that would be a good starting spot for me to learn about the history and the science. I came across Harry Benjamin in that, and just in the history part of the book. So I kind of wanted to delve deep and kind of understand him as a physician, especially in a time that was very hard for transgender people, and there was a lot of bigotry, and it was normalized bigotry. It was just the standard view to be against transgenderism, and thinking it was some sort of mental illness or delusion, rather than something that was normal and a normal variation of sexuality and gender. I'm going to start with talking about Harry Benjamin's book, The Transsexual Phenomenon. Start with the preface. I'm just going to read his words because I feel like that will encompass who he is, as a person, as a doctor, where he's coming from, in his own words. So for context, this book was written 59 years ago in 1966. A lot of things have changed since then, but it's interesting to see maybe where Harry Benjamin, a doctor back then, thought about transgender issues. There is a challenge as well as a handicap in writing a book on a subject that is yet not covered in the medical literature. Transsexualism is such a subject. So he really is a pioneer of his time. He's really at the forefront of this sort of medicine where not really many people want to touch it, want to help these people. The handicap lies in the absence of all previous observations, which to compare one's own, and which would thus allow a more meaningful appraisal of the entire problem. The challenge lies in the novelty of these observations, and in the attempt to describe clinical pictures and events without any preconceived notions, with no axes to grind, with no favorites to play. Conclusions, therefore, are untainted, growing out of direct observance. So we can see he's a true scientist. He really wants to look at the facts. He's not tainting his observations with preconceived notions, without any of what society views on transgenderism at that time. As one who is neither a surgeon nor a psychiatrist, but rather a student of sexological problems, and also as a long-term practitioner in sexology, I feel myself to be in a good position for necessary objectivity. There exists a relatively small group of people, men more often than women, who want to change their sex. This phenomenon has occasionally been described in its principal symptoms by psychiatrists and psychologists in the past, but a deeper awareness of the problem, and especially its general sexological as well as its therapeutic implications, was largely neglected, at least in the United States. It has been considered only during the last roughly 13 years, and then with much hesitation. In the case of Christine Jorgensen, focused attention on the problem as never before. Without her courage and determination, undoubtedly springing from the force deep inside her, transsexualism might still be unknown, certainly unknown by this term, and might still be considered to be something barely on the fringe of medical science, to detriment if not to desperation of the respective patients. The medical profession would most likely be ignorant on the subject, and still be ignoring its manifestations. Even at present, any attempts to treat these patients with some permissiveness in the direction of their wishes, that is to say, a change of sex, is often met with raised medical eyebrows, and sometimes even with arrogant rejection and or condemnation. Christine Jorgensen was born in 1926, and she was the first American widely recognized for undergoing gender-affirming care and surgery. She was born in the Bronx in New York City. She always felt different. She felt different from the other boys, struggled with her gender identity, and she served in the US Army during World War II. And after returning, she began researching at the time was often referred as sex changes. In the early 1950s, Christine went to Denmark where she had gender affirming surgery. She began taking hormone replacement therapy, and when she returned, she became an international fame sensation overnight. And she wasn't famous just because she was trans, but because she was poised, articulate. She made many interviews and public appearances, worked as a singer, actress, lecturer, speaking up about gender and identity when no one else could or would. And really, she paved the way for broader conversations on gender identity and medical transition. Personally, I think she's a hero. She really is, because she made so much awareness for transgender people. So many people have come out and been brave because of her bravery. It inspires me to continue my work, my journey to being me and being authentically me. And I really recommend everyone to, regardless, doesn't have to be transgender, doesn't have to be, it's just whoever you are, whoever you identify as. Don't pretend to be someone else. Be you. You are beautiful. You are amazing. Like, some examples I always see is like people try to be more charismatic, or people try to be more funny, or when they're really shy and introverted. It's like that's beautiful. You're shy and introverted. That's who you are. I'm not saying that you can be whatever you want to be. Yes, but don't feel like you need to change for anyone, for society, to fit in. Just live your life, dance, sing, love life, and you'll go far. That's what I believe, and I know it's easier said than done. So let's continue talking about Harry Benjamin's preface. And so, without Christine Jorgensen and the unsought publicity of her conversion, this book could have hardly been conceived. If credit therefore goes to her and a few other pioneer patients who made their experience known in the US and in England, so it must go to those courageous and compassionate Danish physicians who for the first time dared to violate the taboo of a supposedly inviolate sex and gender concept, and who published their findings in the Journal of American Medical Association. Furthermore, being true physicians, they considered their patients' interests before they thought of criticism by their colleagues. And this criticism was not long in coming. New and rather revolutionary medical and surgical procedures readily found their opponents, especially since sex was involved. Such contra-attempts? It's a new word that I'm learning. Contratemps, however, is no novelty in the history of medicine. Conservatism and caution are most commendable traits in governing progress in science in general, and of medicine in particular. Only when conservatism becomes unchanging and rigid, and when caution deteriorates into mere self-interest, do they become negative forces, slowing, blocking, and preventing progress, neither to the benefit of science nor to that of the patient. More power, therefore, to the brave and true scientists, surgeons, and doctors who let this patient's interest and their own consciousness be their sole guides. That's beautiful, I don't know, that's so beautiful. I feel like I resonate very much with that paragraph, letting the patient's interest and consciousness guide their treatment. Like what I've learned in medical school is that patient-centered care is the most important thing. You gotta put the patient first. You shouldn't be paternalistic. You shouldn't tell them what you think, like you have to do this and this medication is, we're putting you on this and you have no choice. It's these are the options. What do you think? What's most important to you? We want to work together to come up with the best solution for your health. And we all have biases and self-interest, but we shouldn't let that corrupt our understanding of the science, of stopping patient care. We have to let go of those things. And I think that's pretty cool that even back in 1966, a doctor was thinking like this. So I'm just going to continue. When I decided to write this book with the principal objective of describing my own clinical observations of the past decade, I was well aware that I would meet opposition in various quarters, and by no means not only the medical. Breaking a taboo always stirs quick emotions. The forces of nature, however, know nothing of this taboo, and the facts remain facts. Intersexes exist in the body as well as in the mind. Now, yeah, that's incredible. Like, a lot of doctors talk about, intersex. There are so many conditions, the different chromosome pairings, different phenotypes because of hormones. There's androgen insensitivity. So there's so many different variations of biological sex. But he's talking about that transgenderism exists in the mind as well, and that, like, we're looking at like CT scans and seeing that certain areas of the brain correspond more with the gender that they feel is them, rather than the perceived gender, like, assigned at birth. And that's incredible. So within the mind as well, he's recognizing that actually these people resonate in the mind as female or male when they're presenting differently. I've seen too many transsexual patients let their picture and their suffering be obscured by uninformed, albeit honest, opposition. Furthermore, I felt that after 50 years in practice of medicine and in the evening of life, I do not need to be concerned with the disapproval that touches much more on morals than on science. Yeah, that's, this guy seems like a really cool guy, I gotta say. It's very inspiring. I find it really amazing that Harry Benjamin laid some of the foundation for everything that's happened. Really, I'm really interested to read his work. I'll make some more videos because this is only the preface that we've talked about, kind of getting an understanding of who Harry Benjamin is. And I'm still reading that other book as well, kind of coming into terms with the modern aspects of coming into context of the modern aspects of transitioning and the modern science and research. I just wanted to say that I'm not an expert in these fields, not by any means. I have had medical experience as a medical student, still learning throughout. If I say anything that's incorrect or not historically accurate or anything in particular, I just want you to tell me, because I want to learn. I want to get better and improve, and I will never say I know everything. I don't think I would ever say I'm an expert, because there's so much to learn and there's so much that's unknown out there. There's so much that is unknown, that why would you say that everything is I know everything? I think that kind of position is not a very good one to have. But thank you so much for listening. I hope that was interesting for you, and I hope you'd like more content like that. Thank you so much. Bye.